Everybody ready? When it comes to preventable illnesses and deaths, nothing in Kentucky is as devastating as smoking and tobacco use. The damage is familiar but is still shocking. 7,900 lives lost to smoking in Kentucky each and every year. $1.92 billion in tobacco-related healthcare costs, and an additional $2.3 billion in lost productivity. Yet Kentuckians continue to use tobacco more than the residents of any other state. And as a result, we lead the nation in cancer deaths and rank among the leaders in cardiovascular deaths and many other horrible diseases and chronic conditions. And even if you don't smoke, you don't escape. Exposure to secondhand smoke causes cancer, heart disease, and various respiratory conditions. Furthermore, smokeless tobacco causes cancer and is linked to a variety of mouth lesions, gum disease, and tooth decay, not to mention premature birth and low birth weight. I could go on in describing the ill effects of tobacco use, but what I want to talk about instead are solutions to this problem. The General Assembly and I have taken a number of steps to reduce smoking and tobacco use. These include raising the tax on cigarettes to help price them out of the reach of teens, making Medicaid recipients eligible for nicotine replacement therapy and tobacco cessation medications, expanding counseling services at the Kentucky Tobacco Quit Line to include youth, educating retailers on laws governing sales to youth, banning the sale of e-cigarettes to youth, training grassroots groups on advocating for local smoke-free policies, and the big thing, expanding Medicaid eligibility. When we made that decision in May of 2013, more than 300,000 Kentuckians gained new access to free tobacco cessation resources. Additionally, the Affordable Care Act requires all health insurance plans, whether public or private, to provide comprehensive coverage for tobacco cessation. Since open enrollment last fall, more than 80,000 Kentuckians purchased private health insurance through Connect and now have resources to help them quit using tobacco. And we have seen progress. For example, our youth smoking. That rate has declined from 24.1% in 2011 to 17.9% in 2013. But we need to do more to protect our people. And that's what we're going to do starting today. Effective November 20, the day of the Great American Smokeout, Kentucky is strengthening protections for state workers and visitors by toughening our anti-tobacco policies. 3 changes will be made by an executive order that I have signed today. 1, the existing order that bans smoking in executive branch buildings will be expanded to all tobacco products, including chewing tobacco and snuff and e-cigarettes. Number 2, the ban on smoking in state vehicles will likewise be expanded to all tobacco products and e-cigarettes. And number 3, the ban on tobacco use inside executive branch buildings will be expanded to the exterior of those buildings and will encompass the entire campuses on which those buildings are located. No longer will you have to walk through a cloud of smoke to enter one of these buildings, or sit at a conference room next to a coworker who spits juice from a dip into a bottle. Kentucky is the 5th state in the country to institute such a policy. As the state's largest employer, this will affect hundreds of buildings, tens of thousands of employees, and hundreds of thousands of visitors across the Commonwealth. Now, exemptions to these rules are spelled out in the executive order. They include 4 broad categories. Tourist areas like state parks, highway rest areas, and the Kentucky State Fairgrounds. And that is the outdoors connected with those areas, wildlife management areas, certain facilities run by military affairs, and some state-run skilled nursing facilities, acute care hospitals, and veteran centers. But most of the exemptions governing residential facilities are temporary. These facilities will use cessation programs to help wean their residents and clients off of tobacco, with the goal of becoming entirely tobacco-free in the none-too-distant future. At their root, today's policy changes are about improving our health. About 90% of smokers started before age 18, when they didn't fully appreciate the long-term consequences of this lethally addictive habit. And predictably, surveys show that as many as 70% of smokers have indicated a desire to quit. In 2010, for example, almost 43% of all adult smokers quit for at least one day. But without help, most attempts to kick the habit fail, because quitting isn't easy. As a former smoker, I know. Fortunately, I was able to quit over 40 years ago, and as a cancer survivor also, I'm sure glad that I did. My health is significantly better than it would have been if I were still smoking. More information about the policy, as well as links to tools to stop tobacco use, is available at a new website whose address is in the release. For the health and well-being of all Kentuckians, I encourage all businesses and educational institutions, public and private, as well as any other state and local governmental facilities, to follow this example. That includes the General Assembly, our court system, our universities, and our city halls. Look, we're setting an example here. Over 22,000 members of the State Employee Health Plan, including almost 5,000 state employees, reported in plan year 2014 that they used tobacco. The cost of their health care has in years past been 20% higher than non-users of tobacco. So not only is tobacco use killing our workers and making them sicker, but it is also costing them and us as taxpayers a whole lot of money. That's why reducing Kentucky's smoking rate by 10% over the next 5 years is one of the 7 goals of our recently created Kentucky Health Now initiative led by Lieutenant Governor Jerry Abramson. And it is the goal that will have the single biggest impact on our state's health and economic competitiveness. Kentucky Health Now aims to help Kentucky grab control of our economic future by improving our dismal health rankings through goals and strategies related to problem areas like obesity, cancer, and smoking. Our ability to attract jobs and investment depends in part on building a healthier workforce. That's what CEOs tell us all the time. Now, today's action builds upon steps taken by the legislature in 2006 and by Governor Fletcher before me and by agencies in my administration. But even this current step is not enough. I continue to strongly believe that Kentucky needs to institute a statewide tobacco-free law for public establishments. And I will support such a law in the 2015 legislative session. All workers, no matter what their place of employment, deserve to breathe clean air, just like miners deserve to be safe underground, and manufacturers deserve to be safe on the assembly line. You know, this year is the 50th anniversary of the first U.S. Surgeon General's report alerting Americans to the deadly consequences of smoking. That's 5 decades of warnings. But warnings by themselves, as we know, are not enough. So today, state government takes a stand by taking action to protect staff and visitors at our facilities and encouraging tobacco users to seek help in quitting. Thank you very much. Now, questions?
Governor, is this permanent, or can your successor undo this?
Well, any executive order can be repealed by a governor. And so this will be permanent as long as I'm governor, and hopefully it will show its benefits over the next year and 3 months or so, so that future governors will leave it in place.
And does the executive order include the Capitol building and grounds and the lawmakers who are come here during the session?
The executive order includes in general all state-owned executive branch buildings. Now, the executive order does not include the General Assembly or our court system, although we are strongly encouraging both of those branches of government to abide by this example. It also does not include the constitutional officers because they are elected just like I am, and I felt that they needed the flexibility to make their own decisions. However, we've contacted each one of the constitutional officers, and of those that we've heard back from, all of them are going to buy into this policy. So we haven't heard back from all of them yet.
Governor, have you talked to tobacco companies about this? Any response from them? And would this include the mansion?
Yes, it includes the mansion.
And have you talked to tobacco company officials about this?
No.
Governor, how is this policy going to be policed, and is there any sort of penalty for violating it?
First of all, we're setting an example by establishing this policy, and we're trying to lead by example and to help our workers who smoke to find a way to quit smoking, and to give protection to non-smokers, both workers as well as visitors, from secondhand smoke. Our human resources folks and all of our agencies will be working with our employees who smoke to help them to develop hopefully pathways to quitting smoking or using tobacco, and obviously working with them in the implementation of this policy. We're not going to have a tobacco police as such, but obviously as time goes on, anyone who just repeatedly refuses to abide by the policy would be subject to disciplinary action, just like for any other violation of policy. But we really don't expect that kind of thing. When we instituted the policy for the Capitol building in 2006, it took a while to work with people, but eventually, the enforcement of it didn't create a problem.
And which constitutional officers have you heard from?
We have heard from the Treasurer, the Secretary of State, the Attorney General, and the Auditor. And we've had conversations with all of them, and we haven't heard of a decision from the Commissioner of Agriculture yet.
You mentioned several exemptions, including, I think, acute care hospitals. Why were those exempted from the order?
There are peculiar circumstances with several different areas, and we've tried to be accommodative of those areas. First of all, in the buildings controlled by the Cabinet for Health and Family Services, this policy in general will apply to all of those buildings. However, in the skilled nursing facilities, we have 2 of those, Western State and Glasgow, and the state's 4 intermediate care facilities, being Bingham Gardens, Hazelwood, Oakwood, and Outwood. They will be permitted to use tobacco outdoors on facility property, but most tobacco use among current residents will be transitioned from indoors to outdoors over a 6-month period. That will allow these facilities to make necessary outdoor accommodations, and then new residents will not be allowed to smoke as they come in. They will be advised that this will be a non-smoking facility for them. And then as ones who are there and already smoke phase out of that facility, it will gradually become a tobacco-free facility. It will become tobacco-free immediately for staff and visitors in those facilities. Does that generally cover, Audrey,
Yes,
the approach? You want me to run over some of the other exemptions?
Well,
or-
I guess the reason you did that was why? Just to grandfather the existing patients?
You have
in?
people who already have various health situations and all of that, and we felt like taking a somewhat different approach with these people was acceptable under the circumstances. We don't want to create any additional issues for them when they're dealing with a lot of issues already.
Governor, are we going to see signs like this up to publicize?
Yes, today, I think, let me see if I've got this correct. Today, there will be signs going up on all of the buildings saying that this will go into effect on November the 20th. And then signs will be posted at the entrances to the campuses that this will apply to, so that people driving in can be notified that this will be a tobacco-free campus. And then I think on November the 20th, there will actually be stickers put on all of the doors of the buildings when people go in, where they can see them. You know, this gives us almost 3 months to transition this policy in and to work with our staff and work with our employees so that we can have a smooth transition on this.
What are the 4 other states that already have those?
I think I have that here. Do you have it? Okay. Delaware, Oklahoma, Oregon, and South Dakota. Looks like South Dakota put their policy in 2006, Oregon in 2012, and Oklahoma and Delaware Oklahoma in 2012 and Delaware in 2013.
And whose idea was this? How did this come about?
Well, as you know, we have progressively tried to come up with policies that will move our citizens away from the use of tobacco because it is so harmful to our health, and we have some of the worst statistics in the country in this area. This is the next step in that process, and we think it's a good step and will push us even farther down that road of a healthier Kentucky.
Being as concerned as you are about, the